What if I told you the single most powerful habit for protecting your prostate takes just 30 seconds, and that 9 out of 10 men over 60 are doing the exact opposite every single day? Hello, gentlemen. I'm Dr. Nerita, and as a urologist with 12 years of experience specializing in men's health, I've seen countless men over 60 unnecessarily suffer through prostate issues. I've seen the sleepless nights, the constant anxiety of finding a bathroom, and the surgeries that could have been avoided. Today, I'm pulling back the curtain and revealing 5 daily habits backed by solid research that can potentially prevent 70% of prostate problems before they ever start. We're going to count them down from important to absolutely game-changing. Before we dive into this life-changing list, if you value your comfort, your sleep, and your freedom, hit that like button right now. Comment below and tell me, where are you watching from? And make sure you subscribe so you don't miss strategies that could seriously change your quality of life. Now, stick with me until habit number 1, because it is the easiest, most immediate change you can make starting tonight. Let's get into it. Listen, your prostate is a resilient little gland, but it has been working nonstop for decades. By the time you hit 60, it's been exposed to years of chronic, low-grade inflammation, shifts in your hormones, poor circulation, and cellular stress. This is why conditions like benign prostatic hyperplasia, or BPH, prostate enlargement, affect over 50% of men by age 60, and that number skyrockets to 80% by age 70. The symptoms are agonizing: waking up 3, 4, 5 times a night, that weak, hesitant stream that takes forever to empty your bladder, the constant, panicky urgency that makes you plan your entire social life around the nearest restroom. It strips away your dignity and makes you avoid travel. But here's the crucial truth many men and even some doctors overlook. This progression is not a guaranteed part of aging. We have strong, nationwide data, like studies out of Japan, showing that men who actively practice certain specific lifestyle habits either dramatically delay or completely prevent these problems. Same age, completely different physical reality. The difference? 5 simple, consistent daily choices. The habits I'm sharing today are not random. They target the actual biological mechanisms causing the trouble: chronic inflammation, poor blood flow, hormonal chaos, and cellular pressure. I had one patient, 68 years old, who was up 6 times a night. His life was miserable. After implementing this complete 5-step plan for just 3 months, he was down to 1 trip, maybe 2. He told me, and I'll never forget it, "Dr. Nerita, I got my freedom back. I thought this suffering was just what getting older meant." These habits work. Now, let me show you exactly what they are. If you're ready to take back control, hit that like button. Habit number 5, the gentle power move. Our 5th habit is so simple you might dismiss it, but it's foundational. Walk 30 minutes daily. No excuses. Most men think walking is just for the heart, but they are missing the massive benefit to the prostate. A recent study, published in the British Journal of Sports Medicine, tracked thousands of men and found those who improved their fitness by just 3% annually were 35% less likely to develop prostate issues compared to men whose fitness declined. That's a 35% reduction from just moving. Biologically, walking is a natural anti-inflammatory agent. It improves blood circulation to the entire pelvic floor, delivering oxygen and flushing out inflammatory byproducts that irritate the prostate tissue. Practically, it helps you manage your weight, and we know that excess belly fat is a fuel source for prostate enlargement. Emotionally, it reduces stress hormones, which are notorious for aggravating urinary urgency. The protocol is simple: 30 minutes daily. That can be 1 30-minute walk or 3 10-minute bursts. It should be a moderate pace where you can talk, but you can feel your heart rate lift. No gym, no gear, just consistent daily movement. One patient was completely sedentary. His night trips were 5. After committing to the 30-minute daily walk for 8 weeks, his night trips dropped to 2, and he said his stream was noticeably stronger. He felt energized for the first time in years. Walking 30 minutes daily is non-negotiable, but our next 4 habits are even more powerful. Tell me in the comments, are you walking daily, or has life put you on the couch? Habit number 4, the hidden trigger. This one often surprises men who consider themselves moderate drinkers. Limit alcohol to 3 drinks weekly maximum. You'll hear general advice that moderate drinking is fine after 60. When it comes to the prostate, it's not. Research analyzing large population data consistently shows that avoiding excessive alcohol is critical, but the surprise is that even moderate amounts after 60 can exacerbate symptoms. Biologically, alcohol is an inflammatory toxin. It causes swelling throughout your body, including your prostate. Even worse, it disrupts the delicate hormonal balance, suppressing beneficial testosterone and allowing estrogen to gain a foothold, which accelerates prostate growth. Practically, it acts as a diuretic, meaning it forces your kidneys to produce more urine, making your urinary urgency and frequency worse, especially at night. Emotionally, it fools you into thinking it's helping you relax, when it's actively sabotaging your sleep and your comfort. The hard limit is 3 to 4 standard drinks for the entire week, not per day. One drink equals 1 12-ounce beer, 5 ounces of wine, or 1.5 ounces of spirits. Try to have 2 alcohol-free days between drinking. I had a patient who was having 4 or 5 drinks nightly. His symptoms were out of control, waking up every hour. When he cut down to 3 drinks weekly, his symptoms noticeably improved within 4 weeks. He told me, "I thought alcohol helped me relax. It was destroying my prostate the entire time." Limit your alcohol to 3 drinks weekly. Your prostate will thank you almost immediately. Stick with me, because the top 3 habits are absolute, scientifically proven game changers. Habit number 3, the kitchen pharmacy. This is a simple, delicious dietary weapon. Eat cooked tomatoes 3 times weekly. Yes, this specific food has some of the strongest research evidence for prostate protection, and most men aren't consuming nearly enough. Tomatoes contain lycopene, a powerful carotenoid and antioxidant that directly neutralizes damaging free radicals in your prostate cells. Biologically, studies show men who ate cooked tomatoes twice weekly had a 28% lower risk of prostate issues. Other research links higher lycopene intake to reduced enlargement and slower disease progression. A 28% risk reduction from something as simple as a tomato. Practically, here's the critical part. Cooked tomatoes offer exponentially more absorbable lycopene than raw ones. Cooking breaks down the cell walls, releasing the compound. And here's a pro tip. Adding a little healthy fat, like olive oil, boosts absorption even more. Emotionally, it gives you a sense of control. You're not relying on a pill, you're using your food as powerful medicine. The protocol, 3 servings of cooked tomatoes weekly. That's tomato sauce on pasta, marinara, a good tomato soup, or roasted tomatoes with olive oil. I had a patient incorporate 3 tomato-based meals weekly, and after 6 months, his PSA levels dropped from borderline high to a healthy, normal range. His general doctor was highly impressed by the improvements achieved through diet alone. Eat cooked tomatoes 3 times weekly. This is a must-do dietary intervention. Habit number 2, the waistline warning. Our second habit is about maintaining a healthy weight and committing to losing 10% if you are currently overweight. This isn't just about how you look. It's about what's happening on the inside. A 2022 study showed a direct connection between your waist circumference, sedentary behavior, visceral belly fat, and prostate enlargement. Simply put, the more fat you carry around your middle, the faster your prostate tends to grow. Biologically, excess body fat is not inert. It's an active endocrine organ. It dramatically increases inflammation and disrupts your hormones, specifically by raising estrogen and insulin while suppressing testosterone. This hormonal environment is a direct catalyst for prostate growth and increases the risk of more aggressive prostate issues. Practically, the encouraging news is that losing just 10% of your body weight can dramatically improve prostate health. The sustainable approach is portion control. Use smaller plates, reduce your portions by 20% to 25% at every meal, and stop eating when you're 80% full, not stuffed. Emotionally, losing weight reduces the stress on your body and increases your confidence. It's the feeling of being light on your feet again. Combine this with your daily 30-minute walk, and you create a powerful, sustainable weight loss engine. I had a 62-year-old patient who was 240 pounds. His prostate was significantly enlarged. After losing 25 pounds over 6 months, his symptoms improved dramatically, and his urologist noted a measurable reduction in prostate size on his follow-up exam. Commit to losing 10% through portion control and walking if you're overweight. Okay, you've made it to the most powerful habit, the game changer, the one that takes 30 seconds and works tonight. Hit that like button if you're ready. Habit number 1, the instant game changer. This is it, gentlemen. This is the single fastest way to damage your prostate, and the number 1 habit you need to change starting right now. Never hold your urine. Respond immediately. You see, 90% of men over 60 hold their urine multiple times a day without realizing the harm. You do it in a meeting, driving, watching TV, running an errand. Every single time you ignore that signal, you are causing damage. Biologically, when you hold urine, your bladder stretches and becomes overdistended. It's sitting directly on top of the prostate, causing mechanical irritation, chronic swelling, and inflammation. Furthermore, holding it constantly weakens your bladder muscles, leading to that weak, hesitant stream. Stagnant urine can also breed bacteria. Practically, the fix is immediate response. The second you feel the urge to urinate, go. Don't delay. Don't wait. Don't try to finish the TV show. When you know you'll be without a bathroom, slightly reduce your fluid intake ahead of time, rather than holding it for hours. Emotionally, this simple change gives you back control. You stop having to consciously think about or manage an uncomfortable, persistent urge. I had a patient who routinely held his urine for hours during work. He had severe urgency and a weak stream. Once I explained the damage and he started responding immediately to his body's signals, his symptoms improved dramatically within 6 weeks. He told me, "I had no idea holding it was destroying my prostate. This one simple change fixed everything." Never hold your urine. This single habit protects your prostate more than almost anything else. It's the most powerful, the easiest to implement, and it starts working immediately. Comment below right now. Are you holding your urine daily? Be honest. Now that you have all 5, let me give you the exact, systematic way to implement them for maximum results. The 8-week prostate protection system. Tonight, habit number 1. From this moment forward, respond immediately every time you feel the urge to urinate. Never hold it. Tomorrow, morning habit number 5. Set a non-negotiable daily appointment with yourself for your 30-minute walk. This week, habit number 2. Reduce your breakfast portion by 20%. Use a smaller plate. This week, habit number 4. Track your alcohol consumption honestly. Cut it to 3 drinks maximum for the entire week. This week, habit number 3. Buy tomato sauce, marinara, or canned tomatoes. Plan and execute 3 tomato-based meals. Track your progress. Week 1. Note how many times you wake up nightly to urinate. This is your baseline. Week 2 to 4. Continue tracking. Most men notice the first improvements in urgency and nighttime trips within this time frame. Week 6 to 8. Symptoms should improve by 40% to 60%. Stream strength should improve, and urgency should greatly reduce. Quit smoking. If you smoke, quit. Smoking significantly worsens prostate problems and increases cancer risk. Manage stress. Chronic stress releases hormones that aggravate symptoms. Use hobbies, meditation, or light exercise to decompress daily. Annual screening. Get your annual prostate screening starting at age 60. Early detection allows us to use lifestyle interventions before medication or surgery are needed. One last example. A patient implemented all 5 habits systematically. At 6 months, his prostate size had stabilized instead of continuing to enlarge. His overall symptoms improved by over 60%. He told me, "These 5 simple habits gave me my life back. I sleep through the night and I can travel again. This system works." Gentlemen, here's the final takeaway, and it's one of dignity and hope. By age 70, 80% of men have an enlarged prostate, but enlargement does not have to mean suffering. The 5 habits that protect your prostate: walk 30 minutes daily, limit alcohol to 3 drinks weekly, eat cooked tomatoes 3 times weekly, maintain a healthy weight, and never hold your urine are confirmed by science to prevent or dramatically delay the worst symptoms. Men who practice these consistently experience 70% fewer symptoms than men who don't. These aren't complicated medical interventions. They are simple, powerful, daily choices you control. Implement habit number 1 tonight. Tomorrow, add the daily walk. This week, add the others. Within 3 months, you will have established complete prostate protection. You deserve comfort. You deserve to sleep through the night. You deserve your confidence back. If this video helped you feel more in control, hit that like button right now. Comment below and tell me which habit shocked you the most, and subscribe for more science-backed strategies for men over 60. I'm Dr. Nerita. Prostate problems aren't inevitable. Your daily habits determine your outcome. Protect your prostate starting tonight.